Well, we know young people and children are much less likely to get seriously ill from COVID-19 than people who are over the age of 60, but our kids are still paying a price in other ways, especially those who are waiting for surgery. Tonight, Heather Yourex-West looks at the indirect harm COVID-19 is having on Canadian children.
2-year-old Nash Ritchie is waiting for surgery, and because of COVID-19, he'll likely be waiting for some time.
I called to do a checkup and they said it might actually be another 9 months in addition to the time we've already waited.
The Calgary toddler was born with a health condition. The longer he waits to have it corrected, the higher his chances of developing health problems down the road. But the pandemic has created backlogs in surgery, just one of many indirect impacts the virus is having on children's health.
Severe illness and hospital admissions related to COVID-19 have been uncommon in children and young people, yet they will experience substantial indirect physical, social, and mental health effects related to the pandemic.
In an analysis published in this week's Canadian Medical Association journal, Dr. Peter Gill and co-authors take a look at what we know so far. For one, hospital visits by children are down. In the UK, Ireland, and Italy, pediatric admissions to emergency departments fell by 75% during lockdown periods. In Canada, Sick Kids Hospital in Toronto reported 30% fewer children in the emergency room in March and 62% fewer kids in April compared to last year. And while that may be because fewer kids are getting sick or injured while at home, it may also be because parents are choosing to delay care.
We want to communicate to families that healthcare is open, we're available. We've modified our health system to be safe. And certainly if you're worried about your child, you should seek care.
There is also evidence childhood vaccine schedules are being interrupted. In May, the World Health Organization estimated 80 million children have had vaccinations canceled or delayed. But the concerns extend beyond children's physical health. Social isolation protocols are having an impact on their mental and emotional well-being too. Researchers say many of these impacts could lead to long-term health concerns.
I'm scared for him.
For Miranda Ritchie, there is real concern that her son will feel the impact of this pandemic long after the virus is no longer a threat. Heather Yourex-West, Global News, Calgary.
Sunday on Coronavirus, the new reality.
I want to give her a hug, but I can't.
COVID rewrites the minor sports rulebook.
Not only are we missing the game, he's also missing the interaction with his best friends.
The new look of post-pandemic play, Sunday at 7 on Global.